The following is a community affairs presentation from the Ulster County Health Department. This is the Healthy Ulster Radio Show, a weekly presentation exploring community health and sustainability with guests representing a broad spectrum of community partners working to make Ulster County the healthiest in New York State. This program is sponsored by the Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network. Good
morning. You are listening to Healthy Ulster Radio. I am your host, Dr. Carol Smith, Commissioner of Health and Mental Health for Ulster County. With me today is my co-host, Vin Martello, Director of Community Health Relations. Good morning, Vin.
Good morning, Dr. Smith. How are you today?
I'm fine, thanks.
Dr. Smith, Healthy Ulster Radio explores a wide range of community health and wellness topics, ranging from safe and affordable housing to environment to exercise opportunities. Today's topic is equally important, if perhaps not more so, which is mental health. And the topic is Ulster County's mobile mental health team. And it's terrific.
And with us today is our special guest, Patricia Tuber. And Trish works for Access Supports for Living. She's the Assistant Director for Mobile Mental Health. And maybe you can tell us a little bit more about Access, Trish.
Well, good morning, and thank you for having me on the show. I'd love to tell you a little bit more about Access. Access Supports for Living is a relatively large human service agency that is based out of Orange County, New York, but we have services in multiple counties, including Dutchess, Sullivan, and of course here in Ulster County. We do have some programs in Greene County too, and I hope I remembered all of the counties we have services in. But I'm so happy to be here today to talk about the mobile mental health team.
Well, we're certainly happy to have you here and happy to have your services in Ulster County. When the county executive was looking at and we as a department were looking at the needs of the county, one thing was very clear to us that we were missing was mobile mental health services. Trish, could you tell us a little bit more about how mobile mental health services work in Ulster County?
Well, the mobile mental health team has two sites, one based in a Kingston location and the other based in an Ellenville location. And we are funded to provide mobile mental health services for a 12-hour period every day of the year. So we have services from 10 a.m. to 10 p.m., 365 days a year. The reason I emphasize 365 days a year, it's funny when I say every day, people say including Sunday. I'm like, yes, every day, including Sunday. So we're open holidays, weekends, any day, rain, shine, snow, sleet, dark of night. And the only real criteria to use our services is the ability to dial a phone. Now, my staff are trained. They're staffed in each site with 2 staff people. So we have a licensed clinical social worker or a licensed mental health counselor. Those are the 2 highest levels of licensure in our field. And we also have a person who's called a backup practitioner. They can be an LMSW. They can have a bachelor's in human services. They can have a master's in the human service field and working towards their licensure. So we always have 2 people who have a certain level of education and skill in both offices at any given time. So what basically happens is somebody will call the mobile mental health number, and then once we take that call, we speak to the person and we triage. We find out what it is that they're calling about and what the needs are. We try to have a no wrong door approach to services. So I joke that if somebody calls and wants the number for the local pizzeria, we will help them, but we will also explore the reason why they chose to call the mobile mental health team for the number to the pizzeria. Chances are there's something else going on there. So if we cannot directly provide the service that people want, we try to find the service information for them. We try to connect people to services. One of our main, of course, our first and foremost concern is safety. We want the public to be safe. We want the clients calling to be safe. But right underneath that, our focus for most of the work we do is hospital diversion. We're trying very hard to connect people to services or to provide that warm and welcoming, understanding ear to people so that they don't have to go to the emergency room for services that they can now get in the community.
And of course, the word mobile is self-explanatory, but once that phone call comes in and the clinician triages the call and decides this is something that really needs to be responded to, can you tell us a little bit more about how the staff is deployed to the community or to that member of the community that's in distress?
So if a call comes in and we believe that our presence at the person's home or the school or the court or the clinical office or their doctor's office or wherever the person in distress, wherever they are, if our presence can help keep someone from being taken to the hospital, then we go. So then we will try to de-escalate the situation. And so we'll speak to the person, we'll speak to family members, we'll speak to other providers. We'll try to gather as much information as possible about this person and about their lives and their supports and their strengths. And so we will work with that person and we'll work with family members, we'll work with other providers to put a plan in place so that they can stay at home and in the community. And we kind of have a whatever it takes kind of mentality. If someone's willing to work with us, we will work with them to keep them home and safe and connected to services.
And we're presuming that that person can be successfully de-escalated from their crisis, emotional crisis. If they can't be, what would be the next, would the person who responds then decide that, yes, this needs to go to the emergency room for that sort of level of treatment? Could you explain that a little bit as well?
So we know as professionals that if people feel like they have a part in the planning of their services, if they have an active part of what happens to them, things generally work out better. People are more engaged in services. So if we believe somebody does need to go to the hospital, they need to be admitted to be stabilized on medication or for safety reasons, we have that conversation with the person. And we try to work it so that they come to that realization too, that maybe it's better for them to be at the hospital. If we cannot come to that joint conclusion, and my staff feel like the person does need to be in the hospital for safety reasons, we have the ability and the mechanisms in place for us to make that happen. It's our last resort. It's the last choice we want to make, but we are able to do that if we need to.
And after the acute episode has been addressed and perhaps resolved, how do you continue connection with that person to ensure that they are going to make use of the services, the mental health services that exist in the county?
Well, we have an understanding with the hospital. There's actually a couple of agencies that have do follow-up work with Health Alliance of the Hudson Valley through Westchester Medical Center. We have an agreement that if people are being discharged from the emergency room or from the mental health care unit, they sign a release for the hospital to contact mobile mental health, and we do follow-up. So we know, our data shows that the most dangerous time for people, particularly for instances of suicide, is the first 24 to 48 hours after discharge from a hospital. So we try to make that connection immediately. If we know somebody's being discharged in the afternoon, we will contact that person in the evening, either by phone or we'll go out directly. We'll get that information from the hospital about which way is preferred, what's the best method of contact. If we can't reach somebody by phone and there's a higher level of concern because of the reasons why the person was hospitalized, then we go and we knock on the door. Sometimes that is a little bit more effective.
This is for all individuals who are discharged? So
this is for people need to agree to this. Uh-huh. They need to sign the release, and the hospital does their own screening because there's different levels of follow-up. I know that the Mental Health Association does a compassionate call. They have that program where people are referred to that, so people who, when they get discharged, if they want somebody just to touch base, how are you doing? And the acuity level might be less, or the reasons why they were hospitalized might have been different than somebody else where they feel they want a licensed clinical person to be following up.
So out of curiosity, do most of your calls come from individuals in distress themselves or from family members or perhaps an encounter with law enforcement? How does that break down?
Well, I would have to say, this is off the top of my head, I would say 50% come from individuals and families. I would say 25 to 30% come from providers, and another, let's say, 20% or so come from other community agencies.
And so individuals, you said before that individuals sometimes call to just want to talk.
Mm-hmm.
Is it because they think they're calling a crisis hotline, like Families Crisis Hotline, or do they consciously call you because they think that you might be able to help provide an added level of understanding of their issue?
I think that varies from person to person. I have hired a tremendous staff, excellent people, who are incredibly engaging. So we have people who call because they like the people that they talk to on the mobile mental health team. So we don't want to say no to people, but we try to limit those conversations. You can tell pretty quickly that the person's just feeling lonely, and maybe we'll talk to them about, talking to their clinician about how to make friends or how to get involved in some interest groups that maybe they can have more opportunity to socialize. Sometimes people call us because I have made a concerted effort to plaster the mobile mental health number as often and everywhere I can. So people see the number and they call. Sometimes people they don't know what the mobile mental health team is, and they'll call to find out if we can be helpful. We do get a lot of calls for people asking what we do. Mm-hmm. And then other providers have been giving out our numbers. We get a lot of calls from parents from the school systems.
So you also will respond to issues involving teens or pre-adolescents?
Yeah, there's no age limit to anyone. Anyone can use. People come and ask me to speak to groups about the mobile mental health service, and it says it takes me about 5 minutes to describe our services, because if you can use a phone, then that's pretty much it. We will provide services to you no matter how old you are, no matter where you're calling from in Ulster County. You don't even have to be an Ulster County resident. You just need to be in Ulster County and we'll come see you. So it's really pretty open to whoever needs it.
This is a really terrific program, a tremendous asset
to
Ulster County. They do a
wonderful job. It's a great asset.
And we're going to learn a whole lot more about it right after this short break. You're listening to Healthy Ulster Radio. We'll be back soon.
The excitement continues to build. The mission of Health Alliance is now made even stronger by our new partnership with the Westchester Medical Center Health Network. By combining a legacy of community-based care with WMC Health, we are building a stronger, healthier, and more vibrant community. We'll be collaborating to provide preventive, primary, specialty, and advanced care right here where you live, where we all live. Health Alliance and WMC Health, advancing care here. Visit hahv.org to learn more.
Welcome back. You are listening to Healthy Ulster Radio. Our special guest today is Trish Tuber, and Trish is the Assistant Director for Mobile Mental Health Services for Access Supports for Living. Trish, can you tell us a little bit more when you do get a call, and the call is deemed one that should be responded to in person by one of the licensed clinical workers that takes the call. Can you tell us how that goes about happening? Do they arrive with police, with an ambulance? Just tell us a little bit about the way that response would look.
Well, that's a really good question, because that's a concern that people have. So I just want to, we do have teams of two. So we always go out in teams of two, and that's for safety, and sometimes just logistically when we go out to see, a family in crisis, there's generally more than one or two people there. But when we come out, we come out in a regular looking car or an SUV. There's no markings on it. It doesn't say mobile mental health on the side. There's no lights. There's no sirens. When the team is making the decision to go out to the site, we ask a lot of questions. We ask about weapons. We ask about history of violence. We ask, we try to get a good picture of what's going on, and we have to make a determination of whether or not to go with the police. I would say in most instances, we don't think we need to use the police to come out with us. If we do feel we need the police to come out for safety or to make sure everyone stays safe, we contact the local police and we let them know what's going on, and they meet us at the site. And they will make sure everyone is safe, and then we take the lead in doing the clinical assessment.
Do you have the same degree of confidentiality that, say, in a patient-therapist relationship in terms of records and so on?
In terms of records, yes, there's a whole process for releasing information. Because people call us in times of crisis, the HIPAA laws are such that in times of crisis, we can share more information because we do want to make sure people are safe. So let's say you were very suicidal and you were intent upon trying to kill yourself, but you didn't want help, and we needed to get you to the hospital for help. We would have to communicate to the hospital why we were sending you there, even though you didn't want us to say these things. So in those situations, we can communicate, even if somebody isn't necessarily agreeing at that time that they want their information shared.
And so in some instances, do you then, where, say, you've done the short-term intervention, then hand off to another appropriate agency or organization, and I'm sure you have those contacts in your database. How does that work?
So if we go out to meet with somebody and they have not had any experiences with the mental health system and they didn't even know how to go about getting help, we've had examples, let's say families whose children are in distress in the school, like a middle school, we'll give them our number and we'll go out to see the family, and the family is concerned, but they don't know where to really start. So we can talk to them about the services available in their area. We try not to recommend service providers because everyone's experience is different, but we do try to let the families know what's available in their community and to check with their insurance companies and to do an interview process. When you're hiring a therapist, you're hiring someone. So we kind of help families through that process of how do you interview for a therapist for your family or your child? And then we'll connect them to that service. And we ask permission of families to, make sure that, let's say if the school called, we'd say we want the school to know that we did come out and we met with you. We're not going to tell them the content of what happened, but they do need to know that their concerns were addressed and that, we did see you and that everything is going to be moving along in a direction that people are going to get the services that they need. And families are usually pretty good about saying, yes, that's a good idea.
Trish, can you tell us, is there a charge for your service?
Our services are free to the community. We do sometimes ask for insurance information, and that's not for billing. There's a lot of programs and studies going on now by the state and federal government to see what the needs are of different communities for different services. So we keep data for that purpose so that we can show that there's a need for our services, and the way that we can prove there's a need is we can identify people by their insurance information and say, see, this person who has a specific type of insurance is utilizing this service, so it should continue to be funded.
And do you see, in terms of the number of calls that you've gotten over since the inception here in Ulster County, have you seen that steadily increase over time?
Yes, the service usage has increased. Oh my God, it feels like it's almost doubled. I think to date, through the month of November, we have served a little over 1,500 people. Those are 1,500 separate, distinct calls and outreaches.
That's huge.
It's a lot.
It certainly speaks to the need in the community, and certainly around this time of year as well. The holidays very often do evoke feelings of sadness or melancholy, or folks may be drinking more, whatever. So this may be a time of year that the numbers of calls also may increase.
Yeah, we do see a little bit of an uptick, but it's a combination. What's strange is this always surprises people. This is an incredibly stressful time for children. There's the anticipation of the holidays, of Christmas and Hanukkah, and what am I going to get, and will I be good? And sometimes families will, say things not realizing they're creating stress, like if you're not good, Santa's not going to give you this present. And for a child who might have an underlying emotional issue or underlying mental health issue, this creates tremendous stress. So we see a lot more calls regarding children this time of year. As we move more into January, when you have the letdown of the holidays and the days are still short and dark, we see a lot more of the calls from adults who are struggling.
Do you so Do you see like any particular demographic group as being at higher risk, or at least, in terms of utilization of your services?
Well, since our service is primarily for people with mental health issues, we get that's the majority of our calls. So I would say most of our callers have underlying mental health issues. So we don't really track demographics in terms of other issues. We want to provide a open and welcoming kind of experience for people. So we don't want to ask too many questions. The data we need to collect to create a record is already too much for some people. And I do also want to stress, if you call us, you have the option of remaining anonymous. You do not have to give us your name. We don't want people to feel like if they want to remain anonymous, they still can't get help. So people will call us to talk and not give us their names or their identifying information, and that's fine too.
And so much of what we do in Ulster County, as you know, Trish, is about prevention. And our prevention agenda is very robust. So on that note, when you go out to do community presentations, it might be a school or a community organization, what are the kinds of things that you talk about? Do you include preventative type of discussion and trying to educate people about what factors help contribute to a healthier person, mentally and physically?
Well, when I talk to community groups, I'm usually describing our service, but when we talk to service recipients, people who use our services, it still surprises me how often people don't realize that the mind and body are one unit, and that if you're not taking care of your body, it affects your mental health. So we talk about getting proper sleep, proper nutrition, getting some exercise. Moving your body can change your emotional state. We talk about how every thought, feeling, and action you have is a chemical reaction in your brain. And those chemicals, you can activate certain chemicals that can actually make you feel better with things like positive self-talk or exercise or eating a good meal or just changing something in your environment. So we have that discussion with people a lot. And we hope people take in the information.
It's interesting because we did a show just previous to your arrival, and we talked about that very thing. It was about exercise programs at the Y, and talking about, in addition to all the obvious physical benefits, that there was social connectivity involved, where people come together on a regular basis, and the mental and emotional benefits of a healthier lifestyle, or healthier choices, really. Your program is really terrific. We are so lucky to have it here in Ulster County.
As commissioner, and Trish provides me with data, and I just really am just so grateful for the work that you folks do. You do it so well. I really see that very important need that the county executive, my kind, recognized, being really satisfied to a very professional, in a very professional way, and we're very happy to have you with us in the county, and really are very proud to call you our colleagues in the work that we do. So thank you very much for that.
Well, not to sound like a mutual admiration society, I just want to say it's been a great pleasure to work here in Ulster County with all of the providers. I know that we were talking about what providers we work with, and we'll work with any provider in this community, and we've had really positive experiences, and the teamwork and collaboration that happens in Ulster County is a real joy and a real pleasure to work with. If I can leave us with one message,
absolutely, that number,
it would be, if you are out in the community and you don't know if you should call mobile mental health, call us. We'll let you know. If you're unsure whether or not this is a mental health crisis, call us. We can help you figure that out. In other words, call us and we will help you figure out what service should work best for you.
When in doubt, call.
When in doubt, call. And if you're not sure you're in doubt, call us. That number to call is toll-free, 1-844-277-4820.
Say that again.
1-844-277-4820. Call us any day between 10 a.m. and 10 p.m.
And the US is Ulster County's mobile mental health team. They are here to serve you no matter what your situation is, your age is, your circumstances are. They're here as a tremendous community asset. So thank you, Patricia, for your dedication and your effort and those of your team. It's really a terrific asset.
It's been a pleasure, Trish. Thank you.
Thank you.
That's all the time we have for now. You're listening to Healthy Ulster Radio. Please tune in next week where you can find out more great information that you can use to keep yourself, your family, and your community healthy and strong.
You've been listening to the Healthy Ulster Radio Show, a community affairs presentation from the Ulster County Health Department, sponsored by Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network. Thanks for listening, and be sure to join us for another edition of the Healthy Ulster Radio Show next week.